Hello, welcome to my channel. My name is Alasha Ellis and today's topic is Pharmacology Fundamentals, a beginner's guide to understanding medications. Pharmacology is the branch of medicine and biology that studies how drugs interact with the human body. For caregivers, nursing students, and healthcare professionals, understanding the fundamentals of pharmacology is essential to safely administering medications and recognizing their effects. Whether you're caring for elderly patients or managing chronic conditions like diabetes or hypertension, this basic knowledge can help prevent errors, promote recovery, and improve patient outcomes. Pharmacology involves the study of how drugs work, how they are absorbed, distributed, metabolized, and excreted by the body. It is typically divided into two main branches. Pharmacokinetics, what the body does to the drug, absorption, distribution, metabolism, and excretion. Pharmacodynamics, what the drug does to the body, mechanism of action, therapeutic effects, and side effects. Let's cover the key concepts in pharmacology: drug classifications, routes of administration, dosage and frequency, side effects and interactions, and the 5 rights of medication administration. Drug classifications. Drugs are grouped based on their chemical structure or the condition they treat. For example, analgesics, pain relievers, e.g. paracetamol, ibuprofen, antibiotics, fight bacterial infections, e.g. amoxicillin, antihypertensives, lower blood pressure, e.g. lisinopril. 1. Routes of administration. Medications can be given in several ways: oral, by mouth, intravenous, IV, directly into the vein, intramuscular, IM, injected into muscle, subcutaneous, SC, under the skin, topical, applied to the skin. Correct dosing depends on the patient's age, weight, kidney function, and condition being treated. Overdose or underdose can cause harmful effects or render the medication ineffective. Upon side effects and adverse reactions. Every drug can have side effects ranging from mild nausea to severe, allergic reactions, organ damage. Monitoring for side effects is a critical part of pharmacological care. Drug interactions. Some drugs interact negatively with others or with food, leading to decreased effectiveness or increased toxicity. Always check for interactions, especially in patients taking multiple medications. The 5 rights of medication administration. A core safety principle in pharmacology is right patient, right drug, right dose, right route, right time. Why pharmacology matters in caregiving and nursing. It ensures safe medication practices. It helps recognize signs of overdose or complications. It aids in patient education, like how and when to take medication. It builds confidence and competence in healthcare delivery. For caregivers especially, even a basic understanding of pharmacology helps bridge the gap between home care and professional medical oversight. Pharmacology doesn't have to be overwhelming. By learning the basics, you empower yourself to deliver safer, more effective care. As we continue this series, we'll explore common medications used in elderly care, how to read a prescription label, and practical tips for organizing medications at home. Stay tuned for the next post, Common Medications in Geriatric Care and What They Do. common medications in geriatric care and what they do. As we age, our bodies change, and so does the way we respond to medications. In geriatric care, it's essential to understand the medications commonly prescribed to older adults, how they work, and what to look out for when administering them. Whether you're a caregiver, nursing student, or healthcare professional, knowing these drugs can help you provide safer and more effective care. 1. Pain relievers and analgesics. Examples: paracetamol, Tylenol, isopicua, ibuprofen, tramadol. What they do: reduce pain, fever, and inflammation. Important notes: paracetamol is often preferred due to its lower risk of stomach irritation. NSAIDs like ibuprofen can cause kidney issues or stomach bleeding in the elderly. Opioids like tramadol are used with caution due to the risk of drowsiness, confusion, and falls. 1. Blood pressure medications, antihypertensives. Examples: amlodipine, lisinopril, losartan, metoprolol. What they do: lower blood pressure to prevent stroke, heart attack, and kidney damage. Important notes: must monitor for dizziness or fainting, especially when starting treatment. Some can affect kidney function. Regular checkups are vital. 1. Diabetic medications. Examples: metformin, insulin, glipizide. What they do: help regulate blood sugar levels. Important notes: risk of low blood sugar, hypoglycemia, especially with insulin or sulfonylureas like glipizide. Metformin may be avoided in patients with kidney issues. 1. Blood thinners, anticoagulants, antiplatelets. Examples: aspirin, warfarin, apixaban, Eliquis. What they do: prevent blood clots, especially after stroke, heart attack, or in atrial fibrillation. Important notes: must be monitored for bruising, bleeding gums, blood in urine or stool. Warfarin requires regular blood tests, INR monitoring. 1. Cholesterol lowering drugs, statins. Examples: atorvastatin, simvastatin. What they do: reduce bad cholesterol, LDL, and prevent cardiovascular events. Important notes: can cause muscle pain or liver enzyme changes. Report any unusual pain or fatigue. 1. Antidepressants and anxiety medications. Examples: sertraline, citalopram, diazepam, used sparingly. What they do: treat depression, anxiety, and sleep disorders. Important notes: some may increase fall risk or cause confusion in older adults. Always monitor mental health and report changes in mood or behavior. 1. Alzheimer's and dementia medications. Examples: donepezil, Aricept, memantine, Namenda. What they do: help manage memory loss and cognitive decline. Important notes: these are not cures, but they may slow symptom progression, can cause nausea, dizziness, or sleep disturbances. 1. Constipation and bowel medications. Examples: lactulose, senna, Docusate. What they do: relieve constipation, a common issue in the elderly. Important notes: chronic use of laxatives should be monitored. Encourage fluid intake and fiber in the diet. 1. Acid reflux and stomach protection. Examples: omeprazole, ranitidine, now less commonly used, pantoprazole. What they do: reduce stomach acid and prevent ulcers, especially for patients on NSAIDs or blood thinners. Important notes: long-term use may lead to nutrient deficiencies like magnesium or B12. Key tips when giving medications to older adults: start low, go slow. Older bodies process medications more slowly. Check for interactions. Many older adults take multiple drugs. Always check for interactions. Monitor for side effects. Watch for confusion, dizziness, changes in appetite, use in ovoti muat. Keep a medication schedule. Use a pill organizer or chart to prevent missed or double doses. Educate the patient and family. Understanding why helps with compliance and safety. Caring for older adults means staying informed about the medications they take. Each pill has a purpose but also potential side effects. By learning the basics of common geriatric medications, you're equipping yourself to deliver compassionate, safe, and knowledgeable care. Next, top. How to read and understand a prescription label so you'll never feel confused at the pharmacy or while administering meds again. Thank you for watching. Please like, share, and subscribe.